The THRIVE project is a project sponsored by the European Commission. We are responding a call of Horizon Europe Mission Cancer. And the purpose of our project is to understand the determinants of response, primary resistance to therapies, and tumor-host interaction in liver cancer in Europe. So for this purpose, we have organized a consortium with 13 partners from 8 countries in Europe. We are addressing the most important issues and challenges that currently happen in the setting of liver cancer, particularly hepatocellular carcinoma and hepatoblastoma. Hepatocellular carcinoma is the primary tumor of liver that is the most common, accounts for 90% of the primary liver tumors, and the incidence is around 1 million individuals globally, around 70 to 8,000 individuals in Europe per year. Hepatocellular carcinoma is caused by hepatitis C, hepatitis B, alcohol intake, and overweight and diabetes. And these are major health problems in Europe. The treatment of this disease has improved throughout the last decade, and 1/3 of the patients were able to apply potentially curative therapies, and in the other 70% of the patients, the treatments are palliative. And therefore, it is considered a tumor, A, that is poorly understood, and B, with a poor outcome, meaning that less than 30% of the patients are alive at 5 years, which represents a medical unmet need. On the other hand, we have hepatoblastoma. Hepatoblastoma is the most common pediatric liver tumor, with an incidence of 1.8 cases per 100,000 inhabitants. This tumor can be tackled with resection, and this can be applied with success in around 70% of the patients. Nonetheless, 30% of the patients recur and have aggressive pattern of progression and dissemination. And these patients are treated with systemic chemotherapy that leads to a lot of toxicity, and therefore understanding the mechanisms of onset and progression of this disease and biomarkers and defining the responders to therapies is a major unmet need. So for that purpose, we put together this consortium. This, to my understanding, is the most solid, potentially the most potent consortium in Europe, sponsored by the European Commission to tackle this disease. So we have organized our study with 6 aims and 11 work packages. The first aim is to understand the determinants of the occurrence of these tumors. So why these tumors occur in some patients and not in the others, which are the main mechanisms leading to the onset of this disease. And for that purpose, we have large cohort of patients with a premorbid disease that we have followed for years, and we will use these patients and their samples to address this concept. The second aim is actually to analyze the tumor and host interactions in liver cancer. And for that purpose, we will use the best experts in cutting-edge technologies, meaning single-cell sequencing, spatial transcriptomics, and also intratumoral microbiome data analysis as a result of the recent studies suggesting that this factor may be pivotal also to understand the progression and the resistance to therapies. The third objective is aimed to understand the main mechanisms of response and resistance to treatments. And for that purpose, we will use the classical approach with biomarkers and next generation sequencing, but also we will use novel technologies like artificial intelligence that we have experts in our consortium. As a fourth aim, we are tackling the understanding of the mechanisms of resistance to therapies. And for that purpose, we will use preclinical models like patient-derived organoids and other means to identify which are the main drivers of primary resistance to therapies, and also to explore and identify novel opportunities of therapy and alternative treatments, even exploring orphan drugs. Then the last two aims are related to a very important interest of the European Commission. The first one associated with the concept of data sharing. We will be part of a European consortium to share the data that has been gathered in the setting of the THRIVE consortium. And the final aim is to actually disseminate the results. It's very important to translate the discoveries of THRIVE into the clinical practice guidelines, into the society, and into the stakeholders to have an impact in the awareness of the disease and also in the future sponsoring of the research. Finally, I would like to highlight that aside of these 13 outstanding partners, or within them, we have two partners that are important stakeholders. The first one is the ELPA, the Association of Patients. We want to involve patients in the design of the studies and also in the analysis of the results, and we want them to understand exactly how this may impact in the clinical benefit for the patients that suffer these two diseases. And secondly, another partner is the European Association for the Study of the Liver. Is the main scientific association in Europe devoted to liver disease, and we want them to also be engaged in order to enhance and disseminate the results of our studies. I think that with this potent consortium, we will be able to achieve the goals that have been described in this project.